Kybella is a medicine that is injected under the chin. This is called the submental area, to dissolve fat. So it's a treatment for people with double chins, but not a lot of skin excess. So for patients that have a turkey gobbler or skin excess, this is not your treatment. In the past, we only had facelift or liposuction, but now, again, this FDA-approved, first ever, minimally invasive, non-surgical treatment for double chin. So how does the drug work? It's injected, just like Botox injections, and what it does is it dissolves the fat cells, and your body then absorbs them. Who's a candidate for this? I already said, patients with isolated fat deposits, not a lot of skin. So patients come in, we put a little marking device on, we do a little series of injections. It takes about 5 minutes. We usually repeat these injections somewhere between 4 and 8 weeks, and most people respond from a series of 2 to 4 injection sessions. After your injections, there's some swelling, there's some discomfort, a little bit of numbness. The people that I've injected report the discomfort to be a level 4 out of 10. So it's not severe, but it does take a couple days to recover. So this is really exciting to have this new treatment, and we're going to inject some Kybella in a second. And if you have any questions, you can contact me at lovethatface.com. This is a little transfer tattoo, and it's very much like a children's tattoo. And what it's going to do is it's going to transfer these little dots to show us not only where to put the Kybella, but it helps us calculate how much we're using. And we'll take that off, and there is our template. Calculate the dose of Kybella. So we've done our tattoo. The dots on the periphery, there's no fat here, so we're not counting them. There's no fat there, there's no fat at the mandibular border. So we really have 22 meaningful dots, and those are the dots that are encircling our fat deposit. So what you do is you take that 22 and you multiply it times 2. That's 44. If you move the decimal point over 1, that is 4.4 milliliters of Kybella. And that's just a tad over 2 vials. Each vial is 2 ml. Now on a small person, they may only need 2 ml, which is 1 vial. On a larger person, they may use up to 6 ml, which would be 3 vials, or 8 ml, which would be 4 vials. In my experience here, we are usually using about 3 vials per patient. So 22 dots, multiply times 2, that's 44. Move the decimal point over 1, that's 4.4, and that's how many milliliters of Kybella we'll use on this patient. Okay, so we've marked our critical landmarks. We want to stay away from the marginal mandibular nerve, the submandibular glands, the thyroid gland, and now we're going to do our actual injection. This is a 1/2 inch needle, and what we're going to do is put the needle in about halfway, and we're going to inject 0.2 ml in each area. Now on the sides here, I'm going to feather it a little bit, so I'll probably put a little bit less, but in the center for sure. And you want to inject perpendicular to the skin. For the sake of the video, so you can see, I'm going to angle the syringe a little bit, but I'm putting 0.2 ml, and again it's a 1/2 inch. This is a 32 gauge needle. Most of our situation here is in the center, so we're going to keep this probably to 4 cc's. So for our treatment, and this is a Botox setup. This is just a 1 ml syringe and a 32 gauge needle. And to get to this is for the pre-platysmal fat. We're not trying to get past the platysma. We're not trying to get to the deep fat. And so we're going to start in the areas that we know we want to hit. And we're going to put that needle in about halfway. And we're going to give 0.2 ml. And we're going to inject just through the dot a bit, not through the dot, just to the side of the dot. And really, here we are. We're about 2 hours after our Kybella injections, and let's turn sideways this way a little bit. So we have some swelling, and you can see how this kind of waddles a little bit. It didn't waddle quite as much, and I expect more of that tonight, and that's probably going to last 3 or 4 days. I would imagine that this is going to be a little bit sore. tonight.
Here we are with
Deborah. We injected her in the video, and this is 24 hours later. She has a couple of bruises there, 4 or 5 little bruise marks, and you can see this mobile tissue here, and that's the swelling, and that'll last for a couple days. So basically, I mean, she's going to work today, so most people would do fine with this. Some patients might swell more. Now, what we did is we had a compression dressing on her last night, just a little ACE bandage type compression dressing, and she feels that this helped and made her feel better. So tell us about your evening.
It was pretty easy. Just kind of hung out and relaxed a little bit. Didn't have much discomfort. I would say a 4 out of 0 to 10. I only took 1 ibuprofen and I did great.
And you have a little numbness.
Yeah, a little numbness there.
And you think you could cover that bruising with makeup if you wanted to?
Absolutely, yeah.
Very good. Thank you very much.
Thank you.